Hydrogen peroxide is one of the most familiar products in almost every home, especially for seniors. Most people recognize it instantly, yet very few truly understand what it can do beyond basic first aid. But what if this simple bottle held far more potential than you were ever told? What if the way you've been using it for years is only scratching the surface? Can a common household solution support oral hygiene in ways dentists rarely explain? Could it play a role in skincare routines that seniors quietly rely on? Is it possible that certain traditional health practices using hydrogen peroxide were dismissed too quickly, even though they've been used for decades? And why do some people swear by it, while others have never heard a word about these uses? As we age, we're often told that certain discomforts, slowdowns, and recurring issues are unavoidable. But is that really true? Or have simple, low-cost solutions been overshadowed by more complex alternatives? What if understanding how something is used makes all the difference between ignoring it and unlocking its real potential? Many seniors are surprised to learn that not all hydrogen peroxide is the same, and that the way it's applied matters just as much as the product itself. So why is this information rarely explained clearly? And why do so many people discover it far too late? In this video, we're revealing the amazing health benefits of using hydrogen peroxide that very few people know about. We've ranked them from the least known to the most powerful, so stay until the end to make sure you don't miss a single detail. Before we get into it, can you do us a quick favor? Like this video and subscribe to join our healthy community. Also, let me know, how old are you and where are you watching from? Drop your country in the comments. I'll take the time to read every single one. All right, let's get started. Top 13 Health Benefits of Hydrogen Peroxide. 13. Helps eliminate seborrheic keratoses. Seborrheic keratoses are very common, harmless skin growths that tend to appear more frequently with age. They often look wart-like, slightly raised, and can range in color from light tan to dark brown. While they are medically benign and do not require treatment, many seniors seek gentle, non-invasive ways to manage their appearance, especially when these growths become irritated by clothing or appear in visible areas. Hydrogen peroxide has drawn attention in this area because of how it interacts with abnormal surface skin cells. Its action is based on controlled oxidation. When applied topically, hydrogen peroxide releases oxygen that helps break down excess keratin, the protein that builds up in seborrheic keratoses. Over time, this process can cause the thickened cells to dry out, loosen, and gradually peel away. This effect has been supported in the medical research. A 2017 study published in the Journal of the American Academy of Dermatology examined the use of stabilized hydrogen peroxide solutions for seborrheic keratoses and found that targeted application helped reduce the thickness and appearance of these lesions by breaking down abnormal surface cells while minimizing damage to surrounding skin. How to use it. Only 3% hydrogen peroxide should be used for skin applications. First, gently cleanse the area with mild soap and water, then pat dry. Using a cotton swab, apply a small amount of hydrogen peroxide directly to the seborrheic keratosis, avoiding surrounding healthy skin. This can be done 2 to 3 times per day. You may notice light bubbling or whitening of the area, which is normal. Over days or weeks, the growth may darken, dry out, and gradually peel away. It's important to be patient and consistent, and to stop use if irritation occurs. Hydrogen peroxide should never be applied to broken skin, and any unusual changes should always be evaluated by a healthcare professional. 12. Helps clean nail discoloration. Nail discoloration is a very common concern among seniors. Over time, nails can become dull, yellow, or stained due to aging, reduced circulation, frequent use of nail polish, exposure to chemicals, or the buildup of surface debris and microorganisms. While this discoloration is often cosmetic rather than dangerous, it can make nails look unhealthy and neglected, even when they are structurally fine. Hydrogen peroxide is well known for its gentle whitening and cleansing properties, which explains why it has been widely used in dentistry and dermatology for decades. When applied to nails, hydrogen peroxide works by releasing oxygen that breaks down surface stains and organic residues trapped in the nail plate. This oxidative action helps lift discoloration rather than simply masking it, allowing the nail's natural color to gradually reappear. Scientific evidence supports this mechanism. A 2015 study published in the Journal of Cosmetic Dermatology examined oxidizing agents used in cosmetic hygiene and confirmed that low-concentration hydrogen peroxide effectively reduced surface staining on keratin-based structures such as nails without penetrating deeply or causing structural damage when used correctly. How to use it? Use only 3% hydrogen peroxide. In a small bowl, mix equal parts hydrogen peroxide and clean water. Soak the discolored nails for 5 to 10 minutes, then gently scrub the nail surface with a soft toothbrush or nail brush to loosen remaining stains. Rinse thoroughly with water and apply a moisturizer or natural oil afterward, as hydrogen peroxide can be slightly drying. This method can be repeated 2 to 3 times per week until improvement is visible. It's important to note that hydrogen peroxide helps with surface staining, not deep nail infections. If discoloration is thick, painful, or spreading, it may indicate a fungal or medical condition that requires professional care. When used properly, however, hydrogen peroxide offers a simple, affordable way for seniors to restore a cleaner, brighter nail appearance safely and effectively. 11. Helps dry out pimples and blemishes. Pimples and blemishes are not just a teenage concern. Many seniors continue to experience occasional breakouts due to hormonal changes, medications, skin thinning, or clogged pores that don't clear as efficiently with age. When bacteria become trapped inside a pore, it can lead to redness, swelling, and infection. This is where hydrogen peroxide's well-known antiseptic properties come into play. Hydrogen peroxide works by releasing oxygen upon contact with the skin. Acne-causing bacteria thrive in low-oxygen environments, so this sudden oxygen release helps neutralize them at the surface level. By reducing the bacterial load in and around the blemish, hydrogen peroxide helps calm inflammation and speeds up the drying process of infected spots. As the area dries, the blemish is less likely to spread or worsen. Research helps explain this effect. A 2016 dermatology review published in Dermatologic Therapy discussed how topical antiseptics, including low-concentration hydrogen peroxide, reduce microbial activity on the skin and support faster resolution of superficial inflammatory lesions when used sparingly. This is why it has long been included in basic skincare protocols for minor skin concerns. How to use it properly. Only use 3% hydrogen peroxide. First, cleanse the skin gently and pat dry. Using a cotton swab, apply a very small amount directly onto the pimple or blemish, never over a large area. Allow it to sit for about 30 to 60 seconds, then rinse with water and apply a light moisturizer. This can be done once daily, preferably at night. Hydrogen peroxide should not be overused, as it can dry out healthy skin and disrupt the natural skin barrier. It is meant for spot treatment only, not full face application. If blemishes are persistent, painful, or spreading, they may indicate an underlying condition that should be evaluated by a healthcare professional. When used correctly, however, hydrogen peroxide can be a simple and effective tool for managing occasional pimples and blemishes. 10. Assists with minor wound cleaning. Our small cuts and scrapes are part of everyday life, even more so as skin becomes thinner and more fragile with age. Minor wounds may look harmless, but if surface bacteria are allowed to multiply, they can slow healing or lead to irritation and infection. This is where hydrogen peroxide has traditionally played a role in basic first aid. Hydrogen peroxide works through a simple chemical reaction. When it comes into contact with blood or damaged tissue, it releases oxygen. This creates the familiar bubbling effect, which helps lift away dirt, debris, and microorganisms sitting on the surface of the wound. By reducing the number of bacteria present immediately after an injury, it temporarily lowers the risk of infection during the critical early stage of healing. Scientific literature supports this limited, short-term use. A 2014 review published in Advances in Wound Care explained that hydrogen peroxide is effective at rapidly reducing surface bacteria in acute wounds, particularly during initial cleaning. However, the same research also emphasized that its role should be brief. as prolonged exposure may interfere with healthy tissue regeneration. In practical terms, hydrogen peroxide is best used right after a minor cut or scrape occurs. After gently rinsing the area with clean water, a small amount can be applied to the wound to help remove contaminants. You may notice bubbling for a few seconds. This is normal and indicates surface cleaning is taking place. Once the bubbling stops, the area should be rinsed again with water and allowed to dry before covering with a clean bandage if needed. It's important to understand its limits. Hydrogen peroxide is not meant for deep wounds, punctures, or repeated daily use on the same injury. After the initial cleaning, the body heals best in a clean, moist environment without continued antiseptic exposure. When used correctly and sparingly, hydrogen peroxide remains a useful tool for seniors managing everyday minor cuts and scrapes safely and effectively. 9. Soothes sore throat. Discomfort. Sore throat discomfort is a common issue for seniors, especially during seasonal changes, dry weather, or periods of lowered immunity. Irritation in the throat is often linked to the presence of bacteria on the surface tissues, which can trigger inflammation, scratchiness, and pain when swallowing. Addressing this surface bacterial buildup is one reason hydrogen peroxide has been discussed in basic oral and throat hygiene for decades. When diluted and used as a gargle, hydrogen peroxide releases oxygen that helps reduce bacteria in the throat and mouth. This oxygen-rich environment makes it more difficult for harmful microorganisms to survive, which may temporarily ease irritation and support a cleaner oral environment. While it does not treat the underlying cause of a serious infection, it can help calm mild discomfort in the early stages. Scientific research helps explain this effect. A 2013 study published in the Journal of Oral Microbiology examined the antimicrobial action of oxygen-releasing solutions in the oral cavity and found that hydrogen peroxide significantly reduced bacterial counts on mucosal surfaces shortly after use. This reduction is one reason it has been included in dental and oral hygiene practices for many years. In everyday use, hydrogen peroxide can be incorporated into throat care by mixing a small amount with water to create a mild gargling solution. The liquid should be gently gargled at the back of the throat for about 20 to 30 seconds, then spat out, never swallowed. This can be done once per day, preferably when throat irritation first appears. Afterward, rinsing the mouth with plain water helps maintain comfort. It's important to keep expectations realistic. Hydrogen peroxide gargling is intended for temporary relief of mild sore throat discomfort, not for persistent pain, fever, or difficulty swallowing. If symptoms last more than a few days or worsen, professional medical evaluation is essential. Used appropriately and occasionally, however, hydrogen peroxide can be a simple supportive option for easing throat discomfort and maintaining oral hygiene. 8. It helps control dandruff and scalp fungus. Dandruff and scalp irritation are very common issues among seniors, often caused by an overgrowth of yeast-like fungi on the scalp combined with slower skin cell turnover. This can lead to visible flakes, itching, redness, and a persistent feeling of discomfort. As the scalp ages, it becomes more sensitive and less efficient at regulating oil and microbial balance, which allows these problems to linger or worsen over time. Hydrogen peroxide has attracted attention in scalp care because of its antifungal and cleansing properties. Its action is based on oxygen release. When hydrogen peroxide comes into contact with the scalp, it creates an oxygen-rich environment that makes it difficult for fungus and yeast to survive. At the same time, it helps loosen dead skin cells and residue that contribute to flaking, allowing the scalp to feel cleaner and less irritated. Scientific research supports this mechanism. A 2012 study published in Mycoses, a peer-reviewed journal focused on fungal diseases, explained that oxidative agents such as hydrogen peroxide significantly reduce fungal activity on the skin's surface. The study highlighted that controlled topical exposure can help manage superficial fungal conditions without aggressive treatments. In practical use, hydrogen peroxide can be incorporated into scalp care by mixing a small amount with water and applying it gently to the scalp using a cotton pad or squeeze bottle. The solution is left on the scalp for a few minutes to allow contact with the affected areas, then thoroughly rinsed out during a normal shampoo routine. This approach is usually done once or twice per week, not daily, to avoid excessive dryness. It's important to understand that hydrogen peroxide supports scalp hygiene, not chronic medical conditions. Severe itching, thick scales, or hair loss may require professional evaluation. When used occasionally and thoughtfully, however, hydrogen peroxide can help reduce flakes, calm irritation, and support a healthier scalp environment, especially for seniors dealing with recurring dandruff or mild scalp fungus. 7. Fights. Foot fungus and athlete's foot. Foot fungus and athlete's foot are very common concerns, especially among seniors. Warm, moist environments. Inside shoes create ideal conditions for fungal organisms to grow, leading to itching, burning, peeling skin, odor, and thickened or discolored toenails. And as circulation slows and skin regeneration decreases with age, these infections can become more persistent and harder to control if not addressed early. Hydrogen peroxide has been explored as a supportive option for foot hygiene because of its antifungal and oxygen-releasing properties. When applied to affected areas, it releases oxygen that disrupts the environment fungi need to survive. This helps limit fungal growth on the skin's surface and reduces the buildup of microorganisms that contribute to athlete's foot and mild nail involvement. At the same time, it helps cleanse dead skin and debris where fungus often hides. Scientific literature helps explain this effect. A 2014 study published in the Journal of Foot and Ankle Research noted that oxidative agents, including hydrogen peroxide-based solutions, significantly reduced fungal presence on the skin when used as part of regular foot hygiene. The study emphasized that consistent surface control plays an important role in managing mild fungal conditions and preventing recurrence. In everyday practice, hydrogen peroxide can be used after washing and thoroughly drying the feet. A diluted solution can be applied to the affected skin between the toes, on the soles, or around the nails using a cotton pad. Allow it to sit briefly, then let the feet air dry before putting on clean socks. Some people also use it as a short foot soak mixed with water, followed by careful drying. This routine is typically done a few times per week rather than daily to avoid excessive dryness. It's important to understand that hydrogen peroxide helps manage surface fungus, not advanced infections. Persistent pain, cracking, bleeding, or thickened nails may require professional treatment. When used consistently and sensibly, however, hydrogen peroxide can support cleaner, healthier feet and help keep fungal growth under control. 6. Clean vegetables and fruits. This may surprise you, but hydrogen peroxide has long been discussed as a simple method to help clean fruits and vegetables before eating them. Fresh produce can carry surface bacteria, pesticide residues, and contaminants picked up during harvesting, transport, and handling. Even fruits and vegetables that look clean may still have invisible residues on their skins, especially leafy greens, berries, and produce that is eaten raw. Hydrogen peroxide works in this setting because of its oxygen-releasing action. When it comes into contact with organic material, it helps loosen dirt and reduce surface-level microorganisms. This does not mean it makes food sterile, but it can support better produce hygiene when used properly as part of a careful washing routine. Many people consider it an extra step beyond plain water, particularly for items that cannot be peeled. In practical use, hydrogen peroxide is usually added in a small amount to a bowl of clean water, where fruits or vegetables are briefly soaked. You may notice light bubbling on the surface, which indicates that residues are being lifted away. After soaking, produce should always be rinsed thoroughly under running water to remove any remaining traces before eating. This final rinse is essential and should never be skipped. It's important to keep expectations realistic. Hydrogen peroxide does not replace proper food handling, refrigeration, or cooking when needed. It is not meant to improve taste or extend shelf life. Its role is simply supportive, helping reduce surface contaminants as part of a broader food safety habit. For seniors especially, good produce hygiene matters, as digestion and immune defenses can become more sensitive with age. When used thoughtfully and followed by a proper water rinse, hydrogen peroxide can be one additional tool to help keep fruits and vegetables cleaner before they reach your plate. 5. Softens and loosens. Earwax. Earwax buildup is a very common issue among seniors and can become more noticeable with age. As we get older, earwax often becomes drier, harder, and more compact, making it difficult for the ear to clear itself naturally. When earwax accumulates, it may lead to muffled hearing, a feeling of fullness in the ear, or ringing sounds or occasional dizziness. Addressing this buildup safely is important, as improper removal can push wax deeper or irritate the ear canal. Hydrogen peroxide has been used in ear care because of its gentle bubbling action. When it comes into contact with earwax, it releases oxygen that helps soften and break apart the hardened wax. This process loosens the buildup, allowing it to move outward more easily instead of remaining stuck against the ear canal. The bubbling effect can also help lift trapped debris, making natural removal simpler and less uncomfortable. In practical use, hydrogen peroxide is typically applied in small amounts while lying on one side, allowing the liquid to sit in the ear for a short period. You may hear or feel gentle fizzing, which is normal and indicates that the wax is being softened. Then after a few minutes, the head is tilted to allow the solution and loosened wax to drain out naturally. The ear can then be gently dried with a clean towel. It's important to understand that this method is intended for mild to moderate earwax buildup, not severe blockages. Hydrogen peroxide should never be used if there is ear pain, drainage, a perforated eardrum, or a history of ear surgery. Overuse can also dry out the ear canal and cause irritation. For seniors dealing with occasional earwax buildup, hydrogen peroxide can be a helpful and widely recognized option. When used sparingly and carefully, it supports easier wax removal while helping maintain clearer hearing and overall ear comfort. 4. Helps reduce oral bacteria and canker sores. Oral health becomes increasingly important with age, yet many seniors experience recurring mouth irritation, bad breath, or painful canker sores. These issues are often linked to bacterial buildup in the mouth, especially when saliva production decreases, dentures are worn, or the immune response weakens. When harmful bacteria multiply, they can irritate sensitive tissues and delay the healing of small sores inside the mouth. Hydrogen peroxide has been used in oral care for many years because of its ability to reduce bacteria on contact. When it breaks down, it releases oxygen, creating an environment that makes it harder for bacteria to survive. This helps lower the overall bacterial load in the mouth and supports a cleaner oral environment, which can be especially helpful during periods of irritation or soreness. For canker sores, hydrogen peroxide may help by gently cleansing the affected area. Reducing bacteria around the sore can limit further irritation and support the body's natural healing process. Some people notice that sores feel less inflamed and begin to heal more quickly when surface bacteria are kept under control. It does not numb pain instantly or cure the underlying cause, but it can help prevent the sore from worsening. In everyday oral care, hydrogen peroxide is commonly diluted with water and used as a gentle mouth rinse. The solution is swished around the mouth for a short time, focusing on irritated areas, then spit out completely. This approach may be used once a day during periods of discomfort rather than as a permanent daily habit. Rinsing with plain water afterward helps maintain comfort. It's important to understand its limits. Hydrogen peroxide is meant to support oral hygiene, not replace brushing, flossing, or professional dental care. Persistent sores, bleeding gums, or pain should always be evaluated by a dental professional. When used occasionally and carefully, hydrogen peroxide can be a useful tool for seniors looking to support oral cleanliness and reduce irritation linked to bacteria and canker sores. 3. Whitens teeth and freshens. Breath. Tooth discoloration and persistent bad breath are common concerns for many seniors. Over time, teeth naturally darken due to aging, thinning enamel, certain medications, and years of exposure to coffee, tea, wine, or tobacco. At the same time, reduced saliva production allows bacteria to build up more easily in the mouth, which can lead to stubborn odors even with regular brushing. Now, hydrogen peroxide is widely used in dental care for its whitening and antibacterial properties, and its effect can be enhanced when combined with baking soda. Hydrogen peroxide works by releasing oxygen that breaks down surface stains on the enamel, while baking soda acts as a gentle abrasive that helps lift those stains away. Together, they support a gradual brightening process without aggressively scraping the teeth. In addition to whitening, this combination helps freshen breath by targeting odor-causing bacteria. Many cases of bad breath are caused by bacteria that feed on food particles and release unpleasant sulfur compounds. By reducing these bacteria on the teeth, gums, and tongue, hydrogen peroxide supports a cleaner oral environment, while baking soda helps neutralize acids that contribute to odor. During the whitening process, a small amount of hydrogen peroxide is mixed with baking soda to form a light paste. This paste is then gently brushed onto the teeth using a soft bristled toothbrush. Brushing should be slow and careful, focusing on the tooth surfaces without scrubbing aggressively. The mixture is left on the teeth briefly, then thoroughly rinsed out with water to remove all residue. It's important to understand that this method is meant for occasional use, not daily brushing. Overuse may irritate gums or increase tooth sensitivity. This approach supports gradual whitening and fresher breath, but does not replace regular toothpaste, flossing, or dental checkups. When used moderately and gently, however, hydrogen peroxide mixed with baking soda can help seniors brighten their smiles while maintaining better oral freshness. 2. Support sinus cleanliness. Sinus congestion is a frequent issue for many seniors, especially during seasonal changes, dry weather, or allergy flare-ups. When the sinuses become congested, mucus can thicken and linger, creating an environment where bacteria may build up more easily. This can lead to pressure around the nose and forehead, headaches, post-nasal drip, and a general feeling of heaviness in the face. Hydrogen peroxide has been discussed in the context of sinus hygiene because of its ability to reduce surface-level bacteria when it is properly diluted and used cautiously. Its action comes from oxygen release, which makes it more difficult for bacteria to thrive on contact. By limiting bacterial buildup near the nasal passages, some people report feeling clearer and more comfortable during periods of mild congestion. It's important to understand that hydrogen peroxide does not cure sinus conditions and is not meant for deep or aggressive sinus treatments. Its role is supportive, aimed at improving cleanliness around the nasal area rather than forcing drainage or replacing medical care. Sinus congestion can have many causes, including allergies, infections, and structural issues, and each requires a different approach. In practical terms, hydrogen peroxide is sometimes included in highly diluted solutions as part of gentle nasal hygiene routines. The focus is always on mild exposure and surface contact, never on strong concentrations or forceful application. Any solution used around the sinuses should feel comfortable, not irritating or burning. If discomfort occurs, use should stop immediately. For seniors, caution is especially important. Sensitive nasal tissues can dry out or become irritated easily, and overuse of any cleansing agent may worsen symptoms instead of improving them. Persistent congestion, facial pain, fever, or thick discolored mucus should always be evaluated by a healthcare professional. When used carefully and sparingly, hydrogen peroxide may help support sinus cleanliness by limiting bacterial buildup associated with mild congestion. It works best as part of a broader routine that includes hydration, clean air, and proper medical guidance when needed. 1. Detoxifies and rejuvenates the body. The final point on our list focuses on something many seniors are actively looking for: a simple way to feel refreshed, lighter, and more energized from head to toe. Hydrogen peroxide has often been discussed in the context of full-body refreshment, particularly when used in baths to support skin cleansing and overall rejuvenation. While the word detox is frequently misunderstood, this practice is less about dramatic cleansing claims and more about supporting the body's natural processes through the skin. The skin is the body's largest organ and plays an important role in eliminating waste through sweat and natural shedding. Over time, dead skin cells, environmental residues, and microorganisms can accumulate on the surface, leaving the skin feeling dull or irritated. Hydrogen peroxide releases oxygen when it comes into contact with the skin, which may help cleanse the surface, loosen impurities, and create an environment that feels cleaner and more refreshed. Many seniors describe hydrogen peroxide baths as invigorating rather than harsh. The experience is often associated with a sense of lightness, reduced skin irritation, and improved overall comfort. Warm water helps open pores, while the oxygenating action supports gentle surface cleansing without aggressive scrubbing. For people dealing with fatigue, muscle heaviness, or skin discomfort, this type of bath is often described as soothing and revitalizing. In practice, hydrogen peroxide is added to a warm bath and the body is allowed to soak for a short period. The focus is relaxation, not intensity. After the bath, rinsing with clean water and moisturizing the skin helps maintain comfort and prevent dryness. This routine is typically done occasionally, not daily. It's important to keep expectations realistic. Hydrogen peroxide baths are not a medical detox or a cure for disease. They are best viewed as a supportive wellness practice that complements good hygiene, hydration, and healthy lifestyle habits. When used thoughtfully, they can help seniors feel cleaner, refreshed, and more rejuvenated overall. Important precautions. Before using hydrogen peroxide in any of the ways discussed in this video, it's essential to understand a few key safety rules. The only type appropriate for general household and personal care use is 3% hydrogen peroxide, which is the standard strength sold in pharmacies. Higher concentrations are far more powerful and can cause serious skin, eye, or tissue damage if misused. Stronger solutions should never be used at home unless specifically directed by a qualified professional. Hydrogen peroxide should always be used sparingly and intentionally, not as a daily or excessive routine. Overuse can irritate the skin, dry out tissues, and disrupt the body's natural protective barriers. If you experience burning, redness, pain, or unusual discomfort, discontinue use immediately. It should never be used on deep wounds, severe burns, inside the eyes, or on areas with active infections unless advised by a healthcare professional. Never mix hydrogen peroxide with vinegar, ammonia, or other household chemicals, as this can create harmful reactions. Keep it out of reach of children and pets, and never transfer it into unmarked containers that could be mistaken for water. For storage, hydrogen peroxide should be kept in its original dark or opaque bottle, tightly closed, and stored in a cool place away from direct sunlight and heat. Light and heat cause it to break down and lose effectiveness. Always check the expiration date, as old hydrogen peroxide becomes less effective over time. Used correctly and respectfully, hydrogen peroxide can be helpful, but safety and moderation always come first. To wrap things up, hydrogen peroxide is far more than a simple wound disinfectant sitting in your medicine cabinet. When used correctly and safely, it can support many everyday hygiene and wellness routines, especially for seniors looking for simple, affordable solutions. From oral care and skin cleanliness to scalp, foot, and sinus hygiene, its versatility comes from one key principle: helping reduce surface bacteria and support the body's natural balance. The real value lies not in overusing it, but in understanding when and how it fits into a healthy routine. As with any home remedy, moderation and proper use are essential. Hydrogen peroxide is not a miracle cure, but when respected and used wisely, it can be a helpful addition to your daily self-care habits. Small, consistent choices often make the biggest difference over time. Thanks for being here and taking the time to learn how to take better care of yourself. And if you want to keep going, we've got more content lined up to help you look and feel your best. Click on one of the videos on screen, and we'll see you there.